Hi, welcome everyone, and thanks for tuning in to this LinkedIn Live on the role of technology in advancing member and patient engagement. We'll give everyone a minute before we begin. In the meantime, it would be good to know if you've already joined us. Just let us know who you are, where you're dialing in from. Priya and I are dialing in from Gurgaon, and Kaushik is dialing in from Bangalore. While we wait for people to join in, Priya, I had a question for you. I know that you're going to attend the health conference next month. Uh, what are you most looking forward to?
Hi, Chunky. Glad to be speaking again on this. So, when we were at HIMSS earlier this year, there were a lot of conversations on cybersecurity, generative AI. So, what I'm looking forward to the most for health is that what is really on the minds of people and what's it creating the new hype cycle in the ecosystem. That's particularly something I'm very interested to hear about, both from the supply as well as the demand community. Apart from it, I think each of these conferences bring in a new flavor of innovations which are happening in the healthcare ecosystem, and would want to see what is that new innovation which is coming up, be it in terms of your telehealth related things or clinical excellence related stuff. So would look forward to all of these things. And lastly, those in-person connects, always great to meet our community again in person during these events.
Yeah, and I think health is a nice event, different from HIMSS, slightly less people. So I'm sure you'll have a good time. So, okay, let's begin, right? And just like before I begin, maybe one more question for the audience, right? So if you can type, what is the biggest buzzword that you hear in patient and member experience or healthcare in general? Right. So with that, let's begin. So welcome everyone again to this LinkedIn Live on role of technology in advancing member and patient engagement. I'm Chunky Satija, and I'm joined by two of our leaders in our healthcare research practice and subject matter experts. So we have Priya Sahani and Kaushik. Welcome both of you. And so, just to set some context, all right, in terms of why we are doing this, why we are talking about this topic. So, I think the backdrop is that if you look at healthcare payers and providers, we've seen a slew of recent appointments of chief experience officers or people with a similar title, right? And uh, all of these individuals in their roles, they've been tasked with enhancing the engagement for their members and for their patients. And naturally, one of the areas where a lot of them are focusing on is in creating a digital first healthcare, right? So there's a lot of tech solutions, technologies that they are incorporating. At the same time, if you think about it from a regulation perspective, CMS is also pushing this through various different regulations, which is why we see a lot of payers and providers, I think, starting to, or not starting to, but I would say invest significantly in this area. And it's also an area where we are receiving a lot of questions from payers and providers on how they should go about it. So we thought it would be good if we discuss some of those with you in this LinkedIn Live. We would also like to hear from you. What are you seeing? Is there anything different that you're picking up? What are you seeing from your conversations? So, with that, why don't I begin with a very open-ended question, right? So, generally, maybe Priya, I'll start with you, right? If you think about like are the conversations that you've had in the last 12 months on patient and member engagement, based on that, what do you think is going on in this area?
Yeah. So I guess, patient and member engagement by no stretch of imagination are newer things that we are talking about. We've been talking about it since a very long period of time now. I guess what's been changing in the last few years is definitely how the health within healthcare also the engagement or the experience that is really demanded by the consumers is going in the direction of where we have a so as to call it a retail like experience. Apart from this, I think one thing which has really nudged these changes is the way CMS has been changing some of its regulations. If you really think about it, CMS is for sure pushing our industry to completely rethink how member engagement has been looked at, be it, having an impact in the CMS star ratings or even hospital consumer assessment, etc. ratings, everything which is related to your experience, clinical care adherence, clinical excellence, etc., is starting to have an impact. And hence there is a new objective by which all engagement officers and digital officers are looking at this ecosystem. As we progress in our discussion today, we'll talk about one of the other aspects, which I think is something that I am picking up a lot since the last, I'll say, 2 to 3 years, which is around how clinical excellence, etc., is becoming a very integral part of patient or member engagement. So it's not just about making those phone calls or reaching out to your patient or member once in a while to gauge their feedback, but how can you provide really personalized engagement to them, which relates all the way back to the care excellence or the clinical engagement that you point to. And there's an interesting thing that I see in the comments here, which is IoT use in patient monitoring and engagement. And that's a great starter to what I was just talking about. That earlier when we were thinking about things, it used to be leveraging a lot of this technology for admin related things. But now we are truly talking about how can you use things like IoT for patient monitoring, not just from a cost reduction perspective, but to actually enhance the experience and improve the outcomes.
Thanks, Priya. And I think you touched on a very important aspect, right? That like if you think about patient and member experience, it's not linked to just one area, right? It is something where a payer or a provider will have multiple touch points with their members and patients, and the focus really has to be how you enhance all of them rather than that investing just in your contact center. Uh, so you also touched on regulations, right? So maybe Kaushik, I'll like ask you a follow-up questions. What are some of the regulations that you think have a bearing on patient and member experience or engagement?
Yeah, sure, Chunky. And maybe before I get on to it, and I think you spoke about it at the start, while some of the focus on patient and member engagement has been driven by technology, the COVID was a significant driver in accelerating it. But I think you kind of called it out correctly, right? Some of it has also been driven by CMS itself, wherein they are trying to put in place mandates or regulations which will act as a catalyst for payers and providers to implement some rules to eventually solve for patient or member experience. So again, I think there have been a lot of initiatives around it, and some of it is also because outcomes are tied to the experience rated initiative. So star ratings is a classic example which the payer industry is trying to solve for. But more recently, I think couple of mandates which I feel are directly impacting experience are two, right? One is the Medicare prescription payment plan, and the second one is the prior authorization mandate. And I'll quickly share some perspectives on both of them and how it kind of impacts customer experience. The first one was around Medicare prescription payment plan, and this mandate was targeted for Medicare beneficiaries, right, who ideally are enrolled into the prescription plans or the Part D of Medicare. And this was targeted to ease the financial burden of the Medicare beneficiaries, right? And I'll also share a little more context here. So generally, before this mandate, people who used to fill out prescriptions, Medicare beneficiaries will ideally have to pay the out-of-pocket expenses either at the pharmacy or at the end of the month. And generally, if these are $1,000, $2,000, they will have to do, and they'll have to pay the entire amount upfront. But with this mandate, one of the things which transformed the financial burden was this payments were spread across 12 months, right? So what it provided patients or members was the flexibility to make these payments in a staggered manner. And to further make this mandate a success, there are also a lot of initiatives around customer experience, be it in terms of support teams, targeted customer agents to help members understand this mandate. That was one. And even from a technology standpoint, there were portals put in place so that members will know if it makes sense for them to kind of enroll into this plan in itself, right? So net, I think one of the initiatives, which was the Medicare prescription payment plan, was helpful in targeting the Medicare beneficiaries and helped ease out the financial burden, which had a bearing on the customer experience. So this was one of the, I would say, recent mandates. The other major mandate, which I think came in recently that also has a bearing, would be the prior authorization mandate, right? Again, this is an issue which the industry has been trying to solve for over the last few years. Because generally, prior authorization is obviously required for any procedure that needs to be given to the patient, and providers and payers used to have a lot of follow ups and going back and forth between before care is eventually given to the patient. And obviously there is a dissatisfaction in patients if this takes a lot of time. But I think with the mandate, I think couple of key takeaways is, one is this is technology driven, so providers can raise a prior authorization request through an API, and payers will have to share the response and also some justification, right? Either if it's being accepted or denied, some justification. So one, there is a technology angle to it, which makes this process seamless, and two is on the timelines. So CMS has mandated the payers to kind of respond within 3 days, right? So again, this is put in place so that patients will not have to wait much longer to get a decision on some of the prior authorization requests. So again, eventually this will help in providing care, I would say, in a faster manner, and eventually this will have a bearing on the patient experience. So I think these are couple of mandates which I feel have significant impact on the member or patient experience.
I think Kaushik, great points. And what you mentioned on prior authorization is pretty interesting, and I actually have an observation there. But before going there, I also have a question for our listeners today. In your opinion, is the biggest challenge which is kind of inhibiting us from adopting a truly great patient or member engagement? And while you type out some of those challenges in your which are most prominent in your opinion, while you were talking about prior authorization and how the new regulations are going to enhance the entire process of seamlessly passing the claims, etc. If we really take a step back and think that why do we really have a bad experience for our members or for our patients? A very big reason of it relates to how the claims get declined. They take a lot of time to get approvals. The prior authorization process takes a lot of time. Your surgeries, a lot of time. Your emergency procedures are put on hold because we are not able to get things in time. So if I have to all summarize all of this, the claims etc, if we really move towards an era in which the claims itself are removed from the entire picture and there's a claimless word, there's a huge probability of enhancing the entire experience. And that's what value based care truly wants to achieve. If we are really able to improve, if we are really able to move towards more value based care related things, the entire objective of having those claims denials, people calling the contact centers, trying to see why their claim got denied, following up for months, etc., is going to get removed, which is, in my opinion, one of the very big pain points that today members and patients have, which is actually inhibiting the good patient and member engagement that we are just talking about.
So you bring up an interesting point, Priya, and I know that I think you mentioned that you've also had a few recent conversations on this, right? And like based on I think those conversations, like how far do you think as an industry we are from getting to a place where we have no claims?
I'll say we are still in very much the initial stages. Why, some of the organizations are moving there. There have been certain partnerships in that direction, but we are still very far away. What we need to do is that the entire partnerships in which the payers and providers are operating as of now need to be revamped or rehauled, and that's going to take some time. But at least we are seeing steps in the right direction where more capitation based payment models, etc., are coming into the picture.
Good points, Priya. And I think this is also an area where anyone from the audience, if you have a point of view, please do write it. I think as we discussed, right, uh, this is an area that we're investigating. We know that this is something which is not like a near-term thing, but how a lot of these organizations are thinking about from a more long-term perspective. So if you have any perspectives, please do add. Now, I think just quickly moving forward, right? And Kaushik, I know that you've like specifically on member and patient engagement, you've been leading a lot of research and having conversations uh, with with buyers on that. Wanted to understand from you what are you hearing from them? What are some of the things which are important for them, and specifically from a capability perspective, what are they really looking for?
Sure. So, Chunky, if we speak to enterprises across their experience journey, ideally their North Star is digitizing and enhancing multiple touch points, right? And when I say touch points, providers will have separate touch points, and this could be around patient access, such as appointment scheduling, patient registration, care management, etc. And from a payer standpoint, it could be around onboarding a member, servicing a member after they have been onboarded, help them transition into a new health plan, providing them options for making premium payments, etc. So these are few of the touch points that they have, and within providers and payers, there are different touch points basis the processes that they have. So the expectations that we hear from payers and providers of member and patient engagement platforms itself is very, very vast and different. So that's why when we speak with enterprises on what they would like in patient and member engagement platform, ideally they have like a prioritized list of offerings or featurings that they want. So there are offerings which they feel are very, very core to their processes and it impacts customer experience the most. That they call as table stake capabilities, and we have kind of identified them as must-have offerings here, the ones which are written on green. And then there are supplementary offerings which are more good to have, and it could have some kind of bearing on member or patient experience. And this is more, I would say, forward looking, right? Ideally they would kind of want to transform these functions as well, but it is probably not as I would say digitally mature as some of the must have offerings. So net net, in terms of enterprise expectations, they have few offerings which are must have, and then there are few offerings which are good to have, which they would most likely adopt moving forward. And within the must have offerings and good to have offerings, maybe I can double click on few of them which are extremely important basis some of our discussions with payers and providers, right? So on the must have offerings, certainly some of the use cases such as pre-registrations or appointment scheduling is certainly important, and we see a lot of enterprises wanting to streamline this because ideally from a provider standpoint, appointment scheduling is more often than not the first touch point or interaction with patient. So they want to make it as seamless as possible so that they can probably streamline some of the other processes moving forward. So in terms of registration or scheduling appointments, it is probably one of the highly adopted technology use cases on the patient engagement side of the house, and that is a must have offering. Similarly, on the must have offerings, if I were to take a payer lens, so providing inputs on plan changes or upgrades is also one of the things that members ideally need. Because typically we see members not having a very good understanding of their coverage. They may want hand holding with regard to the changes in the policies. If they are wanting to switch a policy, they would also want payers and proactively suggesting some options. So these are few of the pain points that we hear from members. So plan changes and upgrades, sharing them proactively with members is also one of the, I would say, core offerings from a payer member standpoint. So I think on the must-have offerings, these are few of them which are more prominent. Again, if I were to double click on a couple of good to have offerings, I think a couple of them which come to my mind on the provider side are wellness tracking and health service surveys and feedback. So ideally, these would be tagged to the virtual care side of the house, or health surveys and feedback are ideally shared to understand the non-clinical drivers which impact care management. So ideally, SDOH, health equity, these are some of the use cases which could get enabled. So even from a provider standpoint, they're ideally looking at streamlining care delivery first, and then eventually they would kind of want to include use cases such as IOMT, remote patient monitoring, SDOH, etc. So so net net, from a good to have offering, these are obviously use cases which are important and we see a lot of investments, but currently it is probably not as matured as what they need to be. And even from an enterprise sourcing standpoint, this is not on top of their list from a current sourcing scenario standpoint.
Kaushik, I have a
Thanks,
follow-up
Kaushik.
question for you. Why don't you go ahead, Priya? I'll go later.
Sure, Shanki. So I think, Kaushik, this is interesting to see that, what are specifically the good to have offerings that you mentioned. For example, your health records access. And, some of it also relates to interoperability. Keeping that in mind, another thing that comes to my mind is that what all of these enterprises kind of want is to move towards a unified digital ecosystem. And to really move towards that unified digital ecosystem, the first thing that they really want is that a lot of these functionalities that they are working towards, be it their must have offerings or good to have offerings, how can you really integrate them with each other? As of now, what happens is that a lot of times, payers or providers, even though they have these things, they are very siloed in nature, which doesn't really lead to that unified experience for your patients or your members. And secondly, also the interoperability part, which I think is also interestingly mentioned in one of our comments. Data interoperability definitely sits as the base of all of these things that we've kind of talking about here. So when all of the features, for instance, if you're really looking at something like appointment scheduling, contact centers, or even health surveys and feedbacks, ideally interoperability is going to be the key to improvise the outputs of all of these individual areas. So to be able to truly move towards that unified digital ecosystem, we definitely need those investments, not just in the must have and good to have offerings, but also in a lot of the other things, like such as your legacy modernization, cybersecurity initiatives, data interoperability, etc., so that you are able to support these initiatives.
So, Priya, then your advice to someone who's building a platform in this area, in addition to focusing on, again, some of these offerings, would it be that they should also focus on data interoperability, cybersecurity, and ensuring that even if they don't have all of these capabilities, how well they're able to integrate in the existing payer or provider ecosystem? For you, would that be the key for some of the platform providers to succeed?
Definitely, I think you very well summarized it. Those would be my key takeaways for any of the platforms that we see existing today.
Great. And Kaushik, given that you talked about these capabilities, right, do you have any advice for any platform vendors who are creating these capabilities? Are there any areas where you see clear room for differentiation?
Got it. Uh, yeah, I think yes, Chanki. I think most of the must-have offerings that you see are, I would say, offerings which most of the supply ecosystem is already catering to. But I think on the good-to-have offerings, if we were to handpick things which could be potential differentiators, I think the billings and payments offering which we have identified is certainly one of them. And while currently there is not a lot of focus there from an enterprise standpoint, but when we speak with payers and providers, besides the care management specific touch points and the pre-registration appointment scheduling touch points, the final touch point is how do they streamline billings and payments for patients or members, right? From a provider standpoint, it could be just uh, paying in the hospital, but from a member standpoint, it could be paying premiums through a portal, etc., which could be more repetitive or annually driven, right? So how do they streamline those touch points? Do they share proactive reminders to kind of make these payments? All of these are potential use cases that we see, and these are also probably offerings which we don't see a lot of platform providers take to the market. So if they were to kind of differentiate their core capabilities against some of their peers, I would say billings and payments would be a great place to start with. And given we are also in the topic of discussing some of the platform providers, and one of the key interesting things that we also notice is we've been running these assessments. We speak with a lot of the buy side and the sell side of the house. Especially, we do see a lot of evolution in the way some of these suppliers are also coming through. So ideally, when we talk about experience, you would think of CRM native providers, your likes of Salesforce and Pega. But I think what has actually happened is outside of the CRM native platform providers, we also see different cohorts of players coming out in this market, right? So the one of the other cohorts is certainly hyperscalers, wherein we see them take an industry cloud offering, be it Microsoft, Google, and embed their engagement capabilities on it. Niche health tech firms is a huge area where we see different kind of firms catering to specific areas in the value chain. So we have players which just focus on patient engagement. We have players that just focus on member engagement, and again for some of the other product categories. And I think one of the interesting categories that we've seen recently is also the EHR vendors, right? So while traditionally they have been known for their core EHR capabilities, storing clinical data, we also see some investments, especially from Epic, around the member or the patient engagement side of the house. Maybe I'll also invite Priya to add her perspectives on Epic because I know she tracks this very closely.
Yeah, so Epic definitely is including a lot of those patient engagement capabilities in its existing systems, seems to be moving towards more of a holistic system. And but from that perspective, there are still modules which are very much required in the patient engagement area, which Epic doesn't seem to be providing today. For example, as we talked about, something like clinical excellence, which is very important when you are thinking about this patient and member engagement. But some of the things around proactive health management or personalized education, etc., are not really modules that are being covered very closely by Epic. Similarly, when we are also talking about using IoT for remote patient monitoring or even using some of the other tools to improvise your health outcomes, those are also not areas Epic seems to be very focused on. And that's also probably where the intervention of some of the CRM players or the new age experience focused vendors comes into play and becomes very important.
Interesting. And so, what would you say would be the way forward for some of the niche providers in this area? Right? Would it be to partner with the likes of Epic, or do you see them more competing with someone like an Epic?
Yeah, I think that's a great question. The nature of the industry is such that there is a lot of room for collaboration for different players. For example, as Kaushik mentioned, we see hyperscalers coming into the picture, CRM vendors, EHR native vendors, and then a lot of specialists also there. Probably a lot of them are specializing in very different things. We are seeing players very focused on appointment scheduling, contact center related stuff. But for care management, they are partnering with some of the others. And on that note, another trend that we have particularly seen is that a lot of the players are now trying to build out their own interoperability layers because, as we just discussed, that kind of seems to become the core for a lot of the different investments that happen in this area. Similarly, on that note itself, there is again a lot of room for collaboration between vendors because there are still a lot of applications or platforms that are not focused on the backend that we talked about, but they are focused on building those applications that can improve experience. And for creating that data storage or data interoperability, they might want to collaborate with some of the other players. So to answer your question, Chunky, while in a broader bucket, all the patient engagement and member engagement players might be competing with each other, but for individual modules to have the best in class solutions, the scope for collaboration is also huge between all of these players.
Yeah, I think that's a nice segue to this slide, right? Because the first thing mentioned here is seamless integration. So I know that Priya, you also touched on this in the earlier part of the conversation where you talked about beyond the capabilities, what is it that payers and providers are looking for from their platforms. So, Kaushik, do you want to share some perspectives on what have you captured as like beyond the capabilities? What are some of the tenets of these platforms which are absolutely essential for payers and providers?
Yeah, sure, Chanki. Actually, it was actually interesting when we were speaking with some of the buyers of these platforms of patient and member engagement platforms, because generally when we talk about some of the selection criteria, we talk about business use cases, right? Or that is what we would ideally pivot toward. While those are certainly important, and we spoke about some of the things a little earlier, but one of the key takeaways for us was outside of just the business capabilities, there are underlying tenets of the solution itself, which actually play into a provider's or rather an enterprise's decision making criteria, right? So when we were speaking with some of the enterprises on both the payer and provider front, there were few I would say parameters which propped up more prominently, and we've kind of listed them basis the inputs that we have got from enterprises, right? So first one was seamless integration. I think Priya briefly touched upon it, but in an industry like healthcare where data is vast and growing, and we have different data sources, right? Be it clinical data, be it claims data, even within clinical laboratory data might be housed separately, SDOH data might be housed separately. So given we have different kinds of data sources, how does a platform kind of integrate with some of these data sources so that you're able to pull together all these data, create a patient 360, and only after you have an integrated data layer would you be able to enable business use cases, right? So I think seamless integration was one of the prominent platform expectations for both payers and providers. So that was one. The second one was having more of modular solutions or personalized modules. And I think this is stemming from the fact that some of these payers and providers would already have some technology solution or capability for few business processes, right? So when they are trying to kind of procure a platform, they may probably not want the entire platform in itself because they may not want to decommission the existing ones. Rather, what they might want is some best of breed capabilities that a platform provider might focus on, right? So that is why I think even from a supplier standpoint, it is important that they kind of provide these platforms in a very modular manner so that they are able to fit their solution within the technology ecosystem of the enterprise, right? So again, having those plug and play component for these platforms would be extremely critical. That is two. The third one is around ease of navigation in itself, and this had come up because ideally the people who are going to use the platform are going to be your clinicians, are going to be your administrative people on the RCM side of the house, or are these are going to be customer experience agents, etc. So you would want these platforms to be easier to be easier to navigate so that they are able to do these business processes in a more efficient manner and provide better responses to patients and members, right? And even to kind of help them with easier for navigation, we do see platform providers providing training modules, providing documentation, etc. But this was also one of the features which had, or rather parameters which had come up. The last two are around artificial intelligence, right? And again, AI is the buzzword, and even in healthcare, we see a lot of focus in AI. We see a lot of use case enablement here. But again, from a platform standpoint, one is some of these platforms are going to be leveraged from a chatbot or a customer service agent standpoint. So having those conversational AI capabilities so that responses can be very personalized and tailored. So this was one. And the other pointer around AI is not just going to be used from a chatbot. Beyond that, can AI streamline personalized member engagement? Can AI streamline omni-channel communication? Can AI streamline some of the payment portals, reminders, etc. Right? So beyond just chatbots, how can AI come into play to streamline some of the other use cases? Right? So I think these were few of the I would say tenets of the platform itself, which had a huge bearing in enterprises choosing a specific platform.
Thanks, Kaushik. And it's a nice segue to talk about AI. But before we do that, just one question for the audience. Like, if there's anything you want us to touch upon that we haven't touched upon yet, just let us know in the questions. So again, let's move to AI, right? So it's rightly a buzzword, but Priya, the challenge to you is, can you talk about what you are seeing from an AI in member and patient experience and not make it sound like a buzzword?
Yeah, I'll definitely take a stab at that. But it might be wrong to say that we are completely past the hype cycle, but definitely we are somewhere in between, which is a good sign. And why I say so is that now is the time that we are making some decisions around what are those use cases in generative AI that can actually move into production. Before I kind of talk a bit more about it, the question that I would have for the audience is, what, in your opinion, is the one most impactful change that generative AI can bring in healthcare? And would love to hear your thoughts on that. If I kind of think about it, about generative AI within healthcare, I'm kind of dividing all the use cases or the art of possibilities into three areas, which is what are the use cases where there is a proof of concept. And to speak about it, there have been honestly hundreds of use cases that have been tried. Unfortunately, not a lot of this has actually moved into the production stage, which is what brings me to the next level, which is proof of value. Now, here is where everything starts coming to reality. There has to be some value, some KPIs, business outcomes, etc., that we are able to achieve and actually take it to our audience. When it comes to the next stage, we are also thinking about proof of scale. Can we really scale some of these initiatives, or are these going to be things which are only going to be used in a smaller aspect? If I think about something like leveraging generative AI in the healthcare construct, and that too particularly in the member and patient engagement construct, I'm able to think of something like appointment scheduling, which might still be farthest in its journey when it comes to adoption in the spectrum of healthcare. And that also kind of puts it in the proof of value scale where it has been adopted, maybe not at a huge scale, but in a sufficient number of organizations, there is value that we are able to achieve. And it's also something which is now increasing in number. If you look at very core healthcare use cases, such as leveraging things for remote patient monitoring, bringing change in clinical excellence, care management, etc., those are areas where we might never achieve a proof of scale, but that's not even the objective. What we are really trying to achieve is some value out of these areas. While the current adoption is in very initial stages, there are some success stories, and most of the organizations are trying to see how well they can amplify it. So, if I have to really talk about 2 to 3 areas where I see more impact, clinical excellence or appointment scheduling are those. Another area where I feel that we can reach a proof of scale, again, we are very, very far away from that. But that area could be something like leveraging generative AI for your contact centers. So, the transformation of contact centers is something that can really be enabled in that area. Healthcare might be one of the later industries to follow suit here. We might take more inspiration from how the other industries are kind of enabling it, but that's still one of the huge spendings that both payers and providers are investing in. And as long as these contact centers are existing into a picture, generative AI can definitely play a huge impact in how those conversations are done, or even to bring down the entire scale of those conversations.
Fantastic. I think that brings us to near the end of this LinkedIn Live. So I think if there are other questions or comments, we are more than happy to take them. In the meantime, as a token of our appreciation for all of you for joining in this LinkedIn Live, we wanted to extend a complimentary offer. So, like if you're interested, you can get access to the patient engagement platform Speak Matrix assessment from 2023. So the link is in the comments. So if this is of interest to you, just please reach out to us. Now, I think before we close, Kaushik, I know that you're planning to lead some more research in this area. Is there anything that you wanted to share with the audience today?
Yeah, sure, Chunky. So I think engagement is an area where, like we discussed, where we see a lot of investments both from payers and providers, and this is also one of our focus areas. So currently, we are running an assessment wherein we are trying to evaluate the leading platform providers who have capabilities across the patient and the member engagement space. So the assessment has been launched. So we are still kind of seeking inputs from some of the leading platform providers. And I think we've done an assessment on the patient engagement side of the house last year. So for this assessment, the scope is going to be broader, wherein we are looking at both payers and providers. And some of the key things that we are looking at is, again, Priya spoke about AI in detail. So again, what are the capabilities that they have across the different experience value chain, be it in terms of the patient access on the onboarding side of the house, be it in terms of care management, be it in terms of customer experience or chatbots, or even in terms of billings and payments, right? So capabilities across these value chain, leverage of latest technologies such as generative AI, automation, etc. So these are few of the things that we would like to learn from the platform providers. And with regard to timelines, we are looking to publish the assessment in November. So, yep. So look forward to hearing from more of them.
Nice. Thanks, Kaushik. So if like from the audience, if you think that your organization or platform would be a good fit for this assessment, do reach out to Kaushik. If you need more details, feel free to reach out to Kaushik. And I think that's it, right? So once again, thanks everyone for tuning into this LinkedIn Live. We'll be back again in the first half of next year with another LinkedIn Live. Till then, take care and thanks for joining in.
Thanks, everyone.